almost to 1 p.m., so we'll be getting started shortly. All right, so thanks everybody for joining us. Again, we're here with Dr. Brandon Worden to present on Free Yourself from Back Pain. Dr. Worden is a doctor of physical therapy, and he's the managing director at Renew Physical Therapy Bridgeport, which is right on Dixie Highway. Thanks to everybody who joined us today, and I'm going to turn it over to Brandon.
Thank you, Kate. Yes, thank you everybody for your time and for coming to learn a little bit about back pain. This presentation has been designed to give you just some general information regarding some of the most common back pain conditions and how therapy can help. Low back pain is the second most common cause of disability in adults and is a very common reason for lost work days. 7.2 million people had arthritis and rheumatism, 6.8 million had back or spine problems, and 3.2 million had heart trouble or hardening of the arteries, just kind of for some comparison there. So, I mean, low back pain is second most with regards to some of those other ones there. And it's estimated that over 80% of the population will experience some type of low back pain in their lifetime, whether that's just kind of a short course or whether that becomes more chronic low back pain. It's not really specified, but low back pain, 20 to 44% of them within 1 year will receive a recurrence of that low back pain too. So happens a lot for a lot of people, and it's very important to kind of talk about and to educate people kind of what to do when you're having low back pain, and to know that there are some treatment options out there. There's an estimated 149 million days of work per year lost due to low back pain. This condition is also very costly, with the total cost estimated to be between 100 to 200 billion dollars annually. A lot of that is kind of healthcare costs, but also just kind of decreased wages and productivity kind of across organizations. There's different types of low back pain, so we'll just kind of define it in terms of time. There's acute back pain, which is an episode that lasts less than 6 weeks. There's subacute back pain, which 6 to 12 weeks. And then after that period of time, it becomes classified as chronic low back pain. So acute low back pain is going to be some type of atypical work, something that you're not used to doing. It can be caused by repetitive lifting, unexpected projects. But the good thing is that it often resolves with rest, kind of changing how you're doing some of those things, whether it's biomechanics or whatever it might be, or even just a short bout of physical therapy, just kind of some education, getting that pain settled back down, and just a lot of education to try to prevent any type of recurrent low back pain or from it progressing to the subacute phase. The subacute is pain that's been kind of persisting beyond just this 6-week phase, where usually it will just kind of come and go pretty easily. Usually it's because people didn't change their activities, or there's just hasn't been an opportunity for this low back pain to really heal up. And then the chronic low back pain is just kind of defined as just kind of being lasting pain. It's reproducible, recurs with repetitive activities, and it doesn't really go away on its own at all. Some risk factors for back pain in general. If you're standing or walking more than 2 hours per day, sitting for more than 2 hours at a time, lifting or moving 25 pounds kind of regularly, whether it's like for a factory job or something like that. If you have kind of chronic depression, if you're just kind of dissatisfied with your job, obesity, poor back endurance, so just kind of some weakness through that region as well, poor core strength, or even just having had low back pain before, kind of that recurrence being a risk factor as well. And it's not necessarily to say that if you have any of these criteria, any of these risk factors, that you are going to develop back pain. It just, once again, 2 or more can kind of start to increase that risk for developing some of this. Some injuries. So we had the risk factors. Now we're kind of talking more about injuries, kind of incidents that can kind of cause some low back pain. Um, Excessive compressive loads. So if you're doing like a lot of lifting, if you are like a furniture mover and you got one of those things kind of up over your back, just kind of a lot of load kind of down through the spine. Excessive tensile loads. So tensile, kind of like thinking like a stretching a rubber band. So like if you're doing like a lot of like repetitive like rotational movements, things like that, kind of also falls under like the rotational loads as well, just kind of changes how that spine is meant to kind of handle some of that pressure. Doing a job that involves like a lot of vibration, if you're running a jackhammer, if you're using some type of machine at work. Decreased vascularity. So if you have some type of medical condition that kind of contributes to that, even if if smoking cigarettes, kind of can also compromise some of that blood supply to those muscles and to some of those tissues as well. Genetic predisposition. So if you have any type of like ankylosing spondylitis, there's some conditions that can contribute to developing low back pain, just kind of out of the blue. Same with like a systemic collagen disease, or repetitive loaded large amplitude exercises. So thinking about like even some exercises that you might do at the gym, that curl machine where you hold onto the weight in front of you, you're kind of going forward and kind of doing those big crunches. That's a pretty high weight depending on what you're using, and it's a large movement with a lot of kind of risk for injury if you're not doing it properly, or if you haven't kind of built up your strength to be able to do that comfortably. Even sit-ups can also be an example of that too. If you're trying to like burn some fat or trying to just kind of get rid of some of the belly fat, I mean, sit-ups and things like that aren't going to be like the best way to eliminate some of that extra adipose tissue in that area, because it's research has shown that spot reduction doesn't really work like that. Aerobic types of exercise are going to be better at kind of burning that fat throughout your body. In physical therapy, some things that we can treat is mechanical low back pain. So things kind of breaking the back pain down into different types of conditions. So such as like a lumbar sprain or a strain. So kind of thinking like those tensile, rotational types of loads, things like that can kind of cause some injury. Degenerative discs or facets, that kind of falls kind of under that, sometimes that genetic types of conditions that people can develop as well. Disc herniation, spinal stenosis. We're going to kind of break down some of these in a little bit here, but just kind of running through some of these. Spinal instability, sacroiliac pain or SI joint pain is another one that kind of might be thrown in with that. Or just simply non-specific low back pain, just kind of hard to put a finger on it, kind of all over. To assist in determining which type of low back pain a patient has, there are many things that must be considered during a skilled therapy evaluation. This can include which positions are comfortable versus painful, muscle tone, assessing mobility of each segment, whether there's radiating pain or numbness, analyzing the mechanism of injury. What did you do to that kind of right before this had started happening, basically. However, costly advanced imaging like an MRI or a CT scan is sometimes the only way to really like truly find out what is going on in the back. But it's also important, like even once we get an MRI or a CT scan, if we end up getting to that point, that's just a snapshot of what's going on in your back. It's just a picture taken at a moment in time. Sometimes with advanced imaging, they find things in your back that may not actually be what's contributing to your pain. So like if you just developed low back pain within the last 2 weeks and they find degenerative disc disease, well, that degenerative disc disease didn't just take 2 weeks to develop. That's been something that's long standing. And whatever happened prior to 2 weeks ago, most recently, that small change in activity was probably too much for those structures in there. So that sometimes it doesn't take much to kind of just push that back into a little bit of inflammation, a little bit of pain. So trying to step back in time, kind of getting your back to the point when it wasn't hurting, we're not going to get rid of the degenerative disc disease, for example, but being able to kind of step back to the point before that irritation started, getting that strength and that recurrent kind of injury of kind of taken care of, we were able to kind of get rid of most of that pain. Next one here. So kind of breaking this down a little bit. So disc herniation, disc bulge, bulging disc, those are all kind of things that kind of fall into this category here. You can kind of see on this, it's an MRI here that we're looking at. It's kind of like a cross section of this, a side view of the spine here. You can see those discs kind of in between each of the vertebrae there. The vertebrae are the kind of like the bony structures here. And you can see down here that they have some bulging or herniated discs. There's kind of different grades. So usually a disc will bulge before it herniates and things like that. But it's most common in younger patients just due to the discs being more fluid, more pliable. It's most commonly felt as kind of like a deep aching pain. It can be just one side, it can be both sides, or it can be kind of just to the center of the spinal cord itself. So you can kind of see in this picture, this one is just off to the side, kind of hitting that nerve as it's exiting the spine. But as I had said, it can also kind of just go right into the spine itself. A common sensation with this also is referred pain, also known as like radiculopathy is the term that they use to kind of describe that, which is usually comes along with like a change in like your reflex, when they take the hammer to your kneecap, sensation. So sometimes you're like feeling pins and needles or numbness, and it may also result in some strength loss. So whether you feel like your legs are giving out on you all of a sudden, those can kind of be some of the symptoms or some concern with that. So degenerative disc, this is most common in more common in elderly patients, just because those discs, as we age, they don't quite have the hydration that they once had. So sometimes they start to lose some disc height. And this will develop a little bit more readily in people who have a history of previous disc injuries. This sometimes felt mostly as like stiffness, painful with kind of a lot of a lack of motion. And people that have degenerative disc disease most often have issues in the morning. And this can kind of left untreated, it can lead to stenosis, which we can kind of see in this picture here. These joints here, you can kind of see these joints where each of the vertebrae are kind of contacting each other. They don't really bear too much of the load. Most of the load through the spine kind of runs through the column here. But these little guys, all these little joints are called facet joints. And with degenerative disc disease, as that disc starts to decay, that's going to narrow. It's going to create extra movement at this facet joint. And your body's going to try to compensate for that by depositing extra bone in those joints. And that bone, as seen in this kind of top-down view, it's going to put pressure on that in the spinal canal, or even kind of in the nerve root as it would exit this level as well. That's called stenosis. That's most common with people who have a lot of pain, like they have a hard time standing up straight. Kind of if you envision just kind of an elderly individual, kind of humped forward, that's probably because like some of that stenosis is limiting them to be able to stand upright, and because they would feel usually a lot of pain with trying to stand too far upright with some stiffness with that. So the next type of low back pain is defined as kind of instability. So the medical term for that is spondylolisthesis. So that's essentially one common type of instability is when these facet joints, this is the bottom of the spine. So the lumbar spine, kind of right where it comes into contact with the sacrum, is where we see this most often. That facet joint will essentially, in some severe cases, it can break, and it will cause a slippage of that vertebral column off of the sacrum, basically. And obviously with the spinal cord running right there, it can do some major damage to the spinal cord, but you would have some pretty significant radicular symptoms. So kind of like that radiating pain, numbness, kind of going down the legs before it would get this far. And there's different grades. So obviously this is a normal spine, and it kind of gets more severe as we go further to the right there. And this is also a bit different than what we consider to be like so the facet joint is fractured in this case, but it's different than if people say they broke their back. There's also something called a compression fracture, which is it's a force coming down from the top, and usually the vertebrae will collapse with something like that, and you'll have it's the issues aren't really as consistent with that. Like you're going to have different symptoms depending on what level and things like that. So when you think of like a spinal fracture, this is just one type of fracture that can occur in the spine. And this instability is most common in people who are obese or even female adolescent athletes. When posture is negatively impacted by the positions in which they're putting their backs. So like, for example, a gymnast doing a lot of extension types of exercises, or just movements kind of like hyperextending. Sometimes those movements will stress this facet joint kind of in the spine, and it can kind of cause a fracture like that. To avoid running into some of these issues, core exercises and education are essential to prevent some of these injuries. That's why you need good athletic trainers, good coaches, people that are kind of aware of the mechanics of the spine and not just purely how you're looking at when you're doing your gymnastics routine, for example. When it comes to managing and treating low back pain, the traditional method has been providing pain medications, so we're not feeling the pain from the low back, using physical agents such as a hot pack, ice pack, getting massages, doing traction, doing the inversion tables hanging from your ankles, or just resting, not having any activity, which has kind of been shown to be the least effective at reducing pain. The more common, or I should say the more common these days, kind of more commonly recommended by physicians and by research, has been shown as being able to focus on controlling pain and inflammation, restoring range of motion, improving muscle function, teaching body mechanics, coordination retraining, and just preventing recurrence. So this is kind of a research-driven approach. And the people who can kind of provide some of this treatment include physicians, physical therapists, chiropractors, massage therapists, and even occupational therapists. So just kind of, there's a lot more to being able to take care of the back pain that we're feeling now and preventing it from coming back than just taking medication and putting a hot pack on it. When it comes to just managing some of that pain in severe cases, it's best to just try to find a position of comfort. If it's more comfortable to lay on your back for a little bit, if that's your sweet spot, or if you need to lay in your recliner chair, or if you need to stand up, sit down, whatever it might be, trying to find that position of comfort just so that the pain can go down. I mean, if you're having like 6, 7, 8, 9, 10 out of 10 pain, you don't want to try to work through something like that. It's going to cause more inflammation and can kind of mess up your pain response a little bit if you try to just endure something like that. So trying to find some position of comfort for a brief time so that you can kind of get back to what you're trying to do, or before you need to like seek some professional help for your low back pain is advisable. Using an assisted device to unload the spines, whether that's kind of like using a brace, like a corset type brace or something like that. Some people find a lot of relief from that, just because it kind of compensates. If you're having a lot of core weakness, that brace will kind of provide you with kind of some of that stability that your muscles aren't able to provide. And there's this restless bed rest protocol, which advises kind of avoiding sitting. It advises lying down for 20 minutes and then standing and walking for 10 minutes. So kind of when you're kind of feeling some of that pain, trying that routine might be able to take the edge off a little bit. And then once again, heat and cold can also be effective at heat's going to be best at kind of relaxing some of those muscles if you're having a lot of spasms. Cold is going to be more effective at kind of decreasing some of the inflammation. And kind of back on the core function. So being able to improve some of that core stability, we basically focus on the muscles of the abdomen, the lower back, and the trunk that provide that structural support to the spine. So the core isn't just the six pack, it's all kind of around the whole body. When it comes to preventing low back pain, being able to perform some regular exercises to strengthen, stretch, and reduce tension to the back may help reduce the risk of injury. So just kind of staying ahead of it, keeping up with some regular activity so that you're using your core muscles, using some of that back mobility, so you're keeping up with that strength and that flexibility through your back, such as walking, swimming, and just exercising good postural awareness, body mechanics while you're working around the house, ergonomics while you're doing some of your work activities, things like that. Some of the things that are incorporated in physical therapy treatment, at least in the exercise category, we focus kind of on positioning. And when it comes to this, I mean, there's no cookie cutter approach. I mean, a treatment program is going to be determined by a skilled assessment of each individual patient, including the type of injury, activities that they're performing, any types of like variations in their pain, things like that. That's why we're not going to be recommending like specific types of exercises if you're having some low back pain. But for positioning, I mean, some people prefer more of like a flex position, some people more of like an extended position, being able to integrate lots of different types of stretches, whether it's stretching out kind of the hips or your back itself, or even the shoulders, depending on where that back pain is at. Also kind of emphasizing just kind of mobility of your spine, improving range of motion. Sometimes we will also do some unloading, some traction, just to kind of help some of those muscles calm down, kind of open up those discs a little bit. We will emphasize a lot of core, hip strengthening, just because that core and the hips are pretty closely intertwined. So if you're having a lot of weakness kind of in your hips, sometimes your core is going to be doing some of the having to compensate for some of that. So being able to kind of wrap it all into one and kind of making sure we're picking out all the deficits is important. Strengthening also kind of encompasses building up some of that stability so that we have a strong foundation for our arms and our legs to kind of move on, and then building up some of that endurance so that we can tolerate if we're standing for work, or if we're working in a factory, for example, again, being able to tolerate working on 8 to 10 to 12-hour shift, doing some of those repetitive movements. We need to have good endurance through these core muscles. And moving on from the exercise category into some of the manual therapy. Manual therapy just kind of implies, a therapist using their hands or different types of tools to elicit some change. And some of like the soft tissues mostly. So like soft tissue mobilization, kind of mobilizing some of the muscles, some of the fascia, mobilizing the joints themselves, whether it is kind of helping to get some gapping at those facet joints, functional massage, kind of taking some of those joints through some range of motion as we're kind of lengthening the muscles, and even just some manual stretching as well. So that's just kind of taking that muscle to the end range and just holding it, trying to allow those muscles to kind of release some of the tension that's kind of built up in them. And then some of the modalities is just kind of passive things, heat, ice, e-stim, or ultrasound. And when it comes to joint mobilization, there's different types of mobs, kind of starting pretty light to just simply reduce some of that pain, or kind of moving up to a higher velocity or a higher grade mobilization to try to improve some range of motion can be the goal. And then kind of back to the modalities. The e-stim can be an effective modality, is just because the units that they have nowadays, I mean, we can even assist you with being able to get a unit that you can take home and just kind of use independently. You can put the patches on, and it can be really effective at reducing the pain just while you're wearing the unit. So I mean, it's some e-stim, like a TENS unit, for example, is only going to be effective while you're actually wearing the stim. Some of the other types of stim, like interferential current and such, can have more long-lasting effects. So like it's actually going to help with decreasing some of the inflammation through your back as well. TENS is common, but it's not as effective as some of the other types. Addressing posture is also very important. Obviously, posture is just kind of a sustained position in which you're going to be holding yourself. So posture is made to be dynamic. We see in these pictures here, somebody with kind of a forward head posture, rounded shoulders, flexed upper back. It's a very common position with desk jobs, just because what we're doing, everything is kind of right in front of us. We're always having to reach forward. And we see in the seated and the upright position here, kind of a proper posture alignment. The ideal posture is commonly thought of as a position that we should try to hold as long as we are standing or sitting. But posture is best thought of as just being dynamic. It's because standing or sitting all day looking like this guy or this guy can also lead to aches and pains. The key is to kind of change positions through the day, shift your weight, but as you kind of try to make your default position kind of these proper resting postures as kind of being your resting position, so that we're not holding this for 4 hours at a time, but that we're kind of moving around a little bit. Joints don't like to stay immobile for a long period of time like that. When looking at kind of desk ergonomics, so if you're doing kind of a sedentary job or working on a computer for a long period of time, just kind of some keys, some things to think about. Standing desks have also become quite popular with people who are now kind of working from home or have that opportunity. Keeping the screen at eye level, keeping the keyboard at a height of 90 degrees with the elbows bent and the shoulders relaxed, and keeping the knees bent, at least in the sitting position, at 90 degrees, your low back supported when you're sitting. And the goal is just reduce the risk of injury with some of these repetitive movements, whether you're kind of reaching across your desk. Just the nature with these sedentary jobs is that a person is sitting in a static position for sometimes hours. And sometimes they're only really getting up to go use a restroom, to run to the printer occasionally. And for that reason, a well-designed workspace is very important. So if you're working at a desk, definitely kind of take a deep dive into, do I have the phone close enough? Is it too far away? Things like that. Just some general postural exercises, things that can kind of be helpful to strengthen some of the right muscles to give you a little bit more of that posture stability. Include kind of standing up against a wall, trying to have your bottom, your upper back, and your shoulders and the back of your head staying in contact with the wall. For concerns of osteoporosis, you could even, if you feel like you're getting shorter, or if you have osteoporosis, kind of measuring up each day just to kind of try to maintain that height. Kind of helps lengthen that spine a little bit. Another one here, just a scapular squeeze with some chin tucks, can also just kind of help avoid that rounded shoulder type of posture and the forward head postures respectively. Doing 10 to 20 reps, holding for about 5 seconds. But obviously if you're having pain while you're doing these, don't continue it. It might be something else going on where you might need kind of a more skilled set of eyes or hands to kind of see exactly what might be contributing to some of your pain. Or if you're kind of having more upper back pain, doing like some thoracic extensions, kind of opening up the chest a little bit, just because that thoracic spine is naturally a bit stiffer, just because all the ribs are attached through your whole rib cage there. So you're just not going to have as much mobility through your kind of mid back region. So just trying to get a little bit of mobility through there can sometimes help some aches and pains there too. When it comes to doing core activation, building up some of that stability, as we had kind of talked a little bit with that spondylolisthesis, being able to activate the transverse abdominis. We can see that here. It's a deeper core muscle. So like the six pack and everything would all be on top of this. The obliques are on top of this guy as well. But this muscle can be challenging to isolate. It's helpful to kind of think of drawing in the stomach versus doing like a crunch. These core stabilizers function similar to like a corset. And the activation also facilitates the activation of the lumbar multifidus. The multifidus is muscles that kind of run along each segment of the spine itself. So those are little muscles kind of in the back, right along each segment of the vertebrae. And they're also very helpful with building up some of that stability too. Also included in the core musculature is the pelvic floor kind of supporting the bottom, and then the diaphragm up top, that the breathing muscle. When you're kind of taking a deep breath, kind of breathing inward, that's your diaphragm kind of pressing down and opening up. So just kind of an image once again of a person kind of palpating that TRA, that transverse abdominis. You can kind of feel it just kind of inward from the front of your hip bones, just kind of coming in a little bit there. And if you kind of focus on pulling in that belly button, you'll usually feel that muscle kind of firming up underneath your fingertips. I just have a couple videos here, just some ergonomical tips for getting in and out of bed, vacuuming, reaching in and out of the laundry, the washing machine, doing laundry, all things that can kind of irritate some low back pain. So we'll just kind of take a look at some of these and might kind of just give you a couple hints of what to do versus what not to do. We'll watch this here. So it's kind of a good example is what to do. So kind of log rolling, kind of making sure that we're keeping that spine relatively stable, and then kind of pressing up so that we're not getting a lot of rotational forces through the spine, and not tweaking any type of muscles if you have a lot of spasms, things like that. A lot of people tend to heave themselves up out of bed, whether they're like using their legs to kind of swing up, or if they are kind of twisting to get out. So the log roll is kind of considered to be the safest method to do that if that's something that's painful for you. Operating a vacuum cleaner can be a challenge in those with poor core strength and people who have the low back pain. Here's a demonstration of both improper and proper techniques. So just kind of sawing away, running the vacuum cleaner, not really moving your feet too much. It's a lot of reaching versus kind of following it along, keeping a smaller range of motion, keeping that back kind of nice and stable. Washers and dryers are particularly challenged just because the movements necessary for getting the laundry in and out of the washer and dryer require quite a bit of position changes depending on top versus front load and things like that. So we'll kind of take a look here at some of the do's and don'ts here. So you can see kind of the consequence of doing a lot of twisting like that. Once again, it's kind of not using a lot of leg movement versus this one, kind of stepping over, using your legs a little bit more, and trying to avoid as much twisting through the back. A good lifting strategy for being able to pick up small things, light things kind of up off the floor is called a golfer's lift. So kind of holding on to an object like a table or a chair or something, and kind of reaching down just with a single hand is a good way to kind of keep that back nice and straight, so that we're not bending forward all the way just from the back. It's from rounding your back forward. So this is just going to keep that back a little bit more stable. When picking up something heavier, sometimes this is a big kind of sticking point with my patients, is trying to educate on the importance of having strength and flexibility to be able to do this properly. and kind of educating on keeping the weight back in the heels and being able to pull the object kind of close up to you, making sure that you're kind of squatting down to pick up the object versus kind of bending over and kind of heaving it up. That's going to kind of stretch that back here, and it can kind of cause some, it compromises that column. That column is made to kind of sit up on top of each other, those vertebrae. And when you're kind of taking it down in that flex position, it's kind of a high risk injury position. So if you're interested in having a skilled examination of your back pain, we have a variety of locations. I'm at the one in Bridgeport full time. So if you ever want to come out, visit, have any questions, we do free screens. Or if you are having back pain, that's something you've been struggling with for a while, or even just kind of more acutely, you can reach out to your doctor. Once again, just kind of come in and we can kind of facilitate that conversation as well. And we can kind of get you added on, even if it's just for 4 weeks of therapy or something like that. I mean, if that's all that's needed. I mean, sometimes it doesn't even take that long to experience some of that relief. So do we have any questions?
Yes, we did have a couple questions that came in. Thank you for sharing all that. By the way, I was adjusting my posture quite a few times as I was learning, so thank you. We had somebody ask specifically about back muscle spasms. Do you have any quick tips or just a first thing to try if someone's having spasms?
Yeah, so back spasms can be quite severe. And something that kind of comes to my mind is this slide when I kind of talked a little bit about some of those severe cases. So kind of finding that position of comfort, if even using like this restless bed rest protocol, avoid sitting, lying down for 20 minutes, and then standing or walking for 10 minutes can be a good way to just kind of mitigate some of that. But you have to remember that this back spasm is happening for a reason, whether you have some instability in your back, whether there's some type of repetitive movement that you're doing, or some strain that your back had experienced that it's just not able to recover from. So, I mean, if it's persisting, you may require just kind of a skilled evaluation, just kind of a personalized treatment plan. If it's something that's not going away within, maybe 2-3 weeks, or if it's getting worse.
Sounds good. That is helpful. We had a question about your thoughts on yoga and how that might be helpful or not helpful for people with back pain.
So if you're already having some back pain, yoga, I mean, there's obviously many different types of yoga and different stages. I mean, if you go to like some beginning yoga, I mean, they're going to focus a lot on breathing. And as we talked about, that diaphragm and kind of building up that core stability can be helpful. But I mean, if you start to get into like some of the higher levels of yoga, if you have poor core strength and you're trying to do some of those moves, you can kind of cause a strain pretty easily. So if you have like a pretty skilled instructor, they can probably kind of grade some of those lighter yoga activities for you. But if you're just kind of doing it independently at home, keeping it lighter with some of the movements can be best. Or if maybe just kind of focusing on building that core strength initially can be a good start. But if you're having a lot of like just chronic low back pain and it's starting to become severe, starting yoga in that situation probably wouldn't be the best, just because if you're already having severe pain, you're trying to introduce all these new movements to try to get some of that relief. It might not be the best thing. You might benefit from maybe some other types of exercises to baby steps before we get to yoga.
Okay. Yeah, that makes sense. Just 2 more questions that I'll go through. I'm kind of looking out for last call if anybody else wants to submit a question. This one I assume is kind of case by case, but somebody asked how much weight is too much to lift for somebody with chronic lower back pain?
So different people, different types of job responsibilities, people can tolerate various amounts of weight. I mean, the human body can accommodate lifting a lot of weight. Lifting that repetitively and how you're managing that weight can be a big component of that. I mean, if you're doing it repetitively through the course of a workday, that's going to be pretty taxing on your body. But I mean, it's hard to say. I mean, if you have like a specific weight, I mean, it's especially with your chronic back pain, was it because of an injury? Was it because of a surgery that you've had? it's hard to put a specific answer to that, but the back can handle a lot. Using proper mechanics is essential. But yeah, it's hard to put an exact number on how many pounds a person should or should not lift.
Okay, that makes good sense too. So this is the last question, unless anybody submits one more. But we had somebody who said she's 63, she's postmenopausal, and she's noticing a lot more aches and back stiffness. She just kind of wanted to know if that might be related to menopause or not necessarily.
Yeah, at that stage in life, I mean, there's a lot of activity changes. So whether you're kind of getting into retirement or whether you change job roles kind of later in your career to do something more sedentary, that can have a large influence on the aches and pains that you're feeling. Also, as we age, just our muscle composition starts to change a little bit. We're not going to have as much elasticity. So the muscles are going to start to stiffen up and they're going to require a little bit more regular stretching, which is one thing that yoga can be helpful with. Or even just kind of a good stretching program that you're doing at home, just making sure you're using, once again, good mechanics with those. That's something that we can educate you on too in therapy. But in menopause itself, I mean, just kind of the changes in hormones and everything within the body can also impact some of those connective tissues as well. So it's whether or not it's directly from menopause itself or just kind of some of those coincidental types of lifestyle changes may also kind of be impacting that too. So it's not necessarily something that you need to suffer through, though. I mean, it is fairly easy, just once again, kind of learning some different ways to care for your body that's getting just a little bit older, a little bit more experienced, just kind of learning how to best take care of yourself at the stage in life where you're at.
Awesome. Well, thank you. I think that's all we have. Thank you to everybody who submitted questions. And thank you, Brandon, for such a great presentation. Just a reminder to everybody who joined us today and everybody who registered but maybe couldn't make it live, you can look for an email that will have the recording of this presentation so you can watch it or re-watch it whenever you'd like to. So thanks again, everybody, and thanks, Brandon, for presenting for us today.
Absolutely, and thank you.